Iron Deficiency Anemia. Welcome to our channel. Today we are going to discuss iron deficiency anemia, its causes, signs and symptoms and treatment options. Iron deficiency anemia is a common medical condition characterized by a deficiency of iron in the body, leading to a reduced ability of the blood to carry oxygen to various tissues and organs. Iron is a vital component of hemoglobin, a protein in red blood cells responsible for transporting oxygen from the lungs to the rest of the body. When the body lacks sufficient iron, it cannot produce an adequate amount of hemoglobin, resulting in anemia. The total body iron in a 70 kilograms man is about 4 gram, out of which about 2.5 gram is incorporated in hemoglobin. Causes of iron deficiency anemia. There are multiple causes of iron deficiency. Number 1 is dietary insufficiency, that is inadequate intake of iron-rich foods. Number 2 is poor iron absorption due to certain medical conditions, for example celiac disease, tropical sprue and Crohn's disease. Number 3 is acute or chronic blood loss. One example of chronic blood loss is gastrointestinal bleeding. Number 3 is pregnancy. Pregnant women may develop iron deficiency anemia due to increased iron demand for development of baby. Number 4 is increased iron demand due to rapid growth during childhood or adolescence. Signs and symptoms. The signs and symptoms of iron deficiency anemia can vary in severity and may include fatigue and weakness, pale skin and mucous membranes, shortness of breath, cold hands and feet and cold intolerance, reduced resistance to infection, altered behavior, for example attention deficit disorder, dizziness or lightheadedness, headaches, brittle nails, pica, that is, craving and consumption of non-food items like ice or clay, difficulty concentrating, rapid or irregular heartbeat, restless leg syndrome, impaired growth in infants, pallor of the mucous membranes, but this is a non-specific finding, spoon-shaped nails, koilonychia, a glossy tongue with atrophy of the lingual papillae, fissures at the corners of the mouth also called angular stomatitis, splenomegaly in severe, persistent, untreated cases. Diagnosis. Iron deficiency anemia is diagnosed through a combination of blood tests, which may include a complete blood count or CBC, serum iron levels, ferritin levels, a protein that stores iron, and a peripheral blood smear to examine the shape and size of red blood cells. Treatment options. Treatment for iron deficiency anemia aims to replenish the body's iron stores and correct the anemia. The choice of treatment depends on the underlying cause and the severity of the condition. Common treatment options include 1. Dietary changes, increasing iron-rich foods in the diet, such as red meat, poultry, fish, beans, lentils, dark leafy greens, and iron-fortified cereals. 2. Iron supplements. In cases of severe deficiency or poor absorption, iron supplements may be prescribed. They are available in various forms, including ferrous sulfate and ferrous gluconate. 3. Treating the underlying cause. If the anemia is caused by a medical condition like gastrointestinal bleeding, it's essential to address and treat the underlying problem. For blood transfusion, in severe cases with dangerously low hemoglobin levels, a blood transfusion may be necessary to provide immediate relief. 5. Intravenous iron. In cases where oral iron supplements are ineffective or not tolerated, intravenous iron therapy may be considered. Remember, it's essential for individuals with iron deficiency anemia to work with a healthcare professional to determine the most appropriate treatment plan, monitor their progress, and address any underlying causes to prevent recurrence. Preventing iron deficiency anemia involves maintaining a well-balanced diet rich in iron and seeking medical attention if symptoms suggestive of anemia develop.